So this week we looked at ADHD, and the first question is, which of the misunderstood minds activities was the most difficult for you? I really struggled with the auditory attention ones because that's probably the hardest method for me to retain information. It takes the most work and like cognition for me to gather and really process that information. And so I could just tell I was getting really frustrated with not being able to hear and tune into what the directions were, especially on that like triangle one. And I began to feel confused and lonely and kind of angry because everyone was distracting my ability to learn that or to complete that task. And yeah, I think the second part of this question is, how did this activity help you to understand what a child or adolescent with learning differences might experience? Going through all the different um, subjects with the different types of learning really taught me how different dyslexia and just learning disabilities in general can present, and how I'm sure it's really challenging as an adolescent and as a child to communicate what the problems are with the learning and how to connect. Like, I couldn't describe per se some of the issues that I was experiencing with like the math ones and the questions, because things were disappearing as I was doing them, or they weren't clear in the reading. And so I was even having a hard time thinking about how I would communicate my problem. So yeah, thinking about Shatkin in that one, and then the PBS experience, just to kind of reference where I'm coming from on those. Number 2, after reading about ADHD and medication, what are your thoughts about treating the disorder with medication? I have a really unique experience with this because I was medicated for ADD from 3rd grade to early high school when I stopped taking my medication for it. So I've experienced the slow release is what I'm trying to say for the medication, and did notice a difference for a long time. But all 3 of my siblings and my mom were diagnosed with ADD or ADHD, and so learning that it is really a family disease, and that the medication for some really can work. There are other environmental factors to look into, like diet and how much exercise and attention the children are getting at home, which can be really big factors to deciding whether or not the child should be medicated or not. But really, it's about the level of disruption and the length of disruption in the child's life that goes into some of that decision making for the client. Yeah, and just thinking about the family disease aspect or family diagnosis, that it is such a genetic disorder in comparison to some of the others, not disease. Yeah, so those are sort of my thoughts about treating this disorder. I think it is necessary sometimes to treat with medication, and that you can see really positive results for some. Also, studies have shown, just one last note, that stimulants remains the most effective and most commonly employed treatment for ADD, according to Shatkin on page 46, although the number of other medications are sometimes utilized, and 87% of outpatient prescriptions given for treatment of ADHD in the United States comprises of stimulants. So, and just thinking about the numbers of ADD and ADHD in our country, it's pretty outstanding. Leave that there for now. Sorry about the disruption, potentially. Okay. Number 3, list 3 things you learned this week and talk about taking forever on this. Sorry, guys. List 3 things you learned this week and talk about how you will integrate them. Try to be a little more rapid fire. Number 1, let the clients develop their own system of reward. And this is from Landreth, thinking from his demonstration with Kate, letting the client really develop their own system of reward and discover their strengths. I was really surprised to see how much he really encouraged her to figure out their own solutions, like how to turn the water on and how to fix the paper when she wanted to change the painting, or unbuild, I think it looked like a playhouse, or some sort of play thing, and just really develop her own sense of strength. And then when she really needed help, it was up to her to ask for it and ask for the specific help that she needed. Like, I needed to turn to the right for the water. The second thing that I really took away from this week is that medication is not all bad, especially from my experience with Adderall, and my own family environment that was surrounded with that. I think I had a pretty big attachment to that. We're over medicated in this country, especially with ADD, and I think that is something culturally to think about. But that sometimes it is the most effective, and studies have shown that it is the most effective. And so, not letting my own perceptions get clouded with sometimes what's best for the clients is really a big learning aspect from this week. And then 3, mentorship with ODD or any of the, what's the word I'm looking for? Disruptive behavioral disorders. I was really surprised to read that, like, Big Brothers Big Sisters and Head Start were some of their main suggestions, and getting re-inspired by that environmental aspect. And sometimes when the child's environment can't change, others in the community can help create that pattern of change in that environment, even if it's for a short time during the week. That can have a huge impact. And the empathy, especially with ODD and the disruptive behavior disorders, and mostly all of them, is just so key. So I feel really grateful that we've learned that basic skill and can implement it into our practice. So leading right into the basic skills, we saw with Dr. Landreth, he utilized empathy and a lot of paraphrasing and reflective feeling reflections. She didn't demonstrate too many feelings, but he employed, like, you think that you should paint, you think that you should go to the bathroom, and really paraphrased exactly what it was she was doing, and made it a non-judgment based and evaluative paraphrase, which I think was really important. He also used, you made it the way you want to, and validating and connecting and affirming the child's experience so that it can help build their own internal system, and observing what you see and not what you think or judge as right or wrong. So you think that picture is a good picture versus, yeah, that picture is really beautiful. Second part of that question, what were your reactions to the video? I was just surprised. I was surprised how much she really navigated where she wanted to go, and that was okay. She was working on destructing that playhouse and got distracted and wanted to play with the phone, and that he was just reflecting, now you want to go play with the phone, and how she really got to decide where she was going and what she was doing, and creating that internal space. Landreth did set limits by especially towards the end when it was time to go. You want to keep playing, and it's time to go. And that was really powerful. What types of toys did you notice in the playroom? So I saw paint, sand, money slash cashier system, puppets, chalkboards, baby dolls, a playhouse, guns and doctor items, phones, and little animal toys, airplanes. I thought that the guns were really interesting to have in the room. Um, I think having a large variety of areas that the children can make different scenes out of their life that they want to and emote the way that they need to, um, and maybe have environmental aspects that are close to them in their home, that may be representative without thinking about how that, without analyzing and pushing to evaluate why that's important, was really interesting. Um, and their items that they may have in their own homes, and so providing like a space of warmth and invitation where the children can interact with toys and things that they feel comfortable with and feel that are developmentally appropriate, I think is also really key. Yeah. Number 5, a parent brings their child in who's acting out in the home and in the classroom, and they're concerned about ADD, but are not certain. Describe what you say to the patient regarding what you've learned about ADD. Well, yeah, I guess to start, I would really just want to hear more from the parent and from the child about the duration of disruption, how much disruption to their life that they think that maybe it is ADHD, and whether the diagnosis or whether some of that includes inattention, hyperactivity, impulse. If it's persisted for 6 months or more, and that at least one of the symptoms happened before they were 12 years old, and if there's impairment in multiple settings. So I think I would just really listen to and for those diagnostic aspects, and helping the parents decide whether more testing is necessary. There isn't like a test the text Shatkin talks about, but there are other tests to evaluate, and you're supposed to have like a multifactual set of information. So you could do like the TOVA, the CPT, the IVA, but you're also looking at those environmental aspects and the level of disruption and how the child's affect and signs and symptoms are present as well. Yeah, so other differential diagnosis might include any kind of behavioral disorders, anxiety, learning disorders, and so potential first steps for the family would be listening to their story and gathering more information and working to find what what is best for the child and what things they need in order to be successful in their schooling and in their life. I think that just for a little visual for number 6, this is the book that I've chosen, Narrative Therapy in Wonderland, Connecting with Children's Imaginative Know-How. Not a huge surprise here, I'm sure, that I'm doing narrative. But I chose it because I am interested in narrative therapy's techniques and tools, especially with kids. Thanks for listening.